Hello, Martin.
Hello there.
So, I'm Bernard Dan.
I'm Martin Smith.
And we're both editors of Developmental Medicine and Child Neurology. And today we're going to talk about a paper entitled Children with Unilateral Cerebral Palsy Showed Diminished Implicit Motor Imagery with the Affected Hand. The authors are Marietje Jongsma, Marjolein Baas, Anouk Sangen, Pauline Aerts, Bob van der Lubbe, Ruud Meulenbroek en Bert Steenbergen. Martin, what did you make of this paper?
Yeah, well, this was a very interesting paper. My background is in acute neurology with an interest in neurodisability, and it did take me quite a few reads to understand the language within this field. But it was very interesting because it looks at children with unilateral cerebral palsy, and it's self-evident that these children have difficulties with movement of the more affected side, and we might come back to that point. But this paper looks at the mental imagery involved in those, in the thought process involved in those movements when the movements are not actually made. And the interesting discussion on mental imagery in the form of explicit or implicit, and this focuses more on implicit tasks. So what was involved in this paper, they had a group of children with unilateral cerebral palsy and a control group of typically developing children. And they presented them images of hands that were either rotated inwards or rotated outwards, and they were either palm up or palm down, and that led to 8 different combinations. And when the images were presented, they had scalp electrodes that were able to deduce the event-related potentials and ineffectively make some inference of the time taken to recognize the orientation of the hand. And there are established findings in typically developing children and adults. And the interesting finding in the children with unilateral cerebral palsy, first of all, there were 10 children, of which 3, their responses were no more than chance, so they were excluded, which is not particularly surprising. And of the 7 remaining children, as you might intuitively expect, they struggled more when the representation was of their affected hand or corresponded to their affected hand. Although when they were able to complete the task, paradoxically they seemed to make fewer errors, if I understand that correctly. But they're fascinating subjects, and it did lead to a whole load of further questions on what's going on with the visual spatial awareness in these children. Do they have unilateral or bilateral brain injuries, even though it's a unilateral phenotype? And how could that be exploited for interventions that can be helpful?
Mm-hmm. Well, you emphasize this contrast between how we call them, how we call this category unilateral cerebral palsy, so emphasizing the unilaterality and also the motor component, presumably. But you say, at least in your experience, there are many other areas to consider there. So what do you feel about this wording, which is standard? It's suggested by Surveillance Cerebral Palsy Europe, this categorization into unilateral versus bilateral cerebral palsy?
Yeah, I think we seem to keep this constantly under review, and there's shifting sands of terminology. I mean, clearly we were struggling with the concept of quadriplegia because of is it predominantly upper or lower limb or similar. Unilateral is not a homogeneous group, though, of course, because you may have children with a predominantly one hemispheric injury, for example, following a neonatal stroke, or you may have a child with bilateral periventricular leukomalacia that's a little more extensive on one side than another. But these are very, very different mechanisms of brain injury, and therefore you would not necessarily expect that their strategies for visual planning and execution and integration of sensory motor cortex is the same. So I think it's helpful because at least we know what we're talking about, but we just always bear in mind that we're not talking about a homogeneous group. And I know many people now like the terminology, recognise that even the good hand is not, if you like, a perfect hand, and that there is often bilateral impairments, even though it's strikingly asymmetrical.
Which is very present here, as the authors consistently refer to more affected or less affected hand. Now, do you think that imaging is how useful is imaging to explore the possibility of other lesions, other locations for injury, to assess cognitive processing, visuospatial processing?
In the sense of brain imaging to it, yeah. I mean, in an ideal world, I would be fascinated to know what the MRI scans as a minimum on these children were, to see how many were predominantly unilateral, how many predominantly bilateral injuries, and also was it predominantly, even the unilateral, was it predominantly motor area or was it sensory motor? Because clearly movement is the end product, but the movement is built on the foundation of sensory input. And so there's a whole series of subcategories, and I think imaging would have been very interesting in this group and in the what next step for this type of work.
Now, there's a very interesting neurophysiology in this paper, and I think this is a very promising approach which has been used in this domain increasingly, but to me this is similar to much of the functional imaging techniques, and yet it's really difficult to address the strategies, because you say, well, motor aspects should not be distinguished from sensory aspects, so it's really a sensory motor task, but here there's a lot of cognitive processing in terms of representation and strategies too. So possibly these techniques may help us approach it, but we're still far from determining exactly how strategies are organized. I like this idea of using motor imagery, which is also very much used in elite sports domain. And we can see this convergence in perspective, in strategies, in the way we try to collect data and interpret data and use that to optimize intervention, both in people with disabilities, including motor disabilities, and in elite sports. Do you feel ready to start introducing some of those components in practice, in clinical practice?
I mean, that's an excellent question. I think you could begin to apply it in little ways already. So, for example, in the children with unilateral cerebral palsy and in other children with disability, there's often one or two goals that they would particularly love to accomplish, which would mean a great deal to them. And in the same way as a golfer wants to get that perfect swing, there is an element of just getting out there and doing it, but there's also an element of getting the right habits and muscle memory as well, I think they call it. So practicing the task, not only acting it out, but thinking it out as well. And I think if you actually would want to modify your strategy, in other words, abandoning a deeply ingrained bad habit, so to speak, and relearning a better habit, I think reinforcement by imagery, I think it would ideally be linked to virtual reality computer games, because I think the motivation element for children is crucial. It's got to be fun.
Yes, absolutely.
So how exactly I would take that to the bedside, I'm not completely sure, but I think it does have tremendous promise.
Yes, and well, there's still important differences that we need to take into account. In video games, there's a lot of implicit processing, and here, for this sort of task, we asking for something that needs to be explicit to some way. The hands that were shown, do you want to comment on that?
Yeah, I thought it was very interesting. Intuitively, it was no surprise that the children struggle with the hand that's presented correlating to their affected hand, but I did wonder if the results would be exactly replicated if the images shown had been of hands of different sizes, because, as you know, commonly a child with unilateral CP will have unequal sized hands, and in a sense, when the child is presented with a typically ill sized hand, they're not looking at their own hand in the same way as I was, presented with your hands. I just think I wouldn't recognise that as my hand, my affected hand, if it was a normal sized hand, and I think it might have slightly confounded them, it may not, but I think that would be very interesting to repeat the study, taking photographs of their own hands, palm up and palm down, and then showing them their own hands.
Yes, yet you refer to video games, and we know that video games are also increasingly studied in management program for children with cerebral palsy, including what is often referred to as serious gaming. And those games often involve avatars. And children don't seem to have major difficulties in projecting themselves
into an avatar. It also reminds me of a case report I saw many years ago, I think it was in the Lancet, of adult stroke patients where they were asked to do a task with affected or unaffected hand, but they had a mirror, so they could see two, if you like, healthy hands, and that actually improved the performance of the affected hand.
Oh, this is coming in the journal too. The use of
it's not a new concept, and yet it might well be dusted down to good effect.
Yes, absolutely. Now there's this question of how you project yourself in what you see, and in that case of mirror therapy, although you know very well that the hand you see is not yours, and it's used in phantom limb syndrome. With dramatic effects on pain. And this relates to another emerging field in neuroscience and in cognitive science, is that of empathy, and how you really adopt somebody else's point of view, how you navigate in an egocentric reference frame, or allocentric, or heterocentric, that is, really pretending you're somebody else and seeing the world from somebody else's
walk in their
eyes.
shoes or walk in their mind.
And I think this is really promising, even though the sample is limited and it's really difficult to study this. I mean, it's a nice paradigm, and it's probably as standardized as it can be. How do you foresee the next steps in this sort of research, and the necessary steps to bring it back into management practice?
I would love to see a little sort of chain reaction going off from this, but I think the first thing is it's an interesting study and it's thought-provoking, but it's a relatively small sample, and I would like to see it replicated in a bigger sample. It's not that difficult to get hold of children with unilateral CP, so I'd like to see a bigger series, and as I said, I'd be fascinated to see with a presentation of affected and unaffected hands in the imaging. I think this it could be exploited in so many ways, but I think I don't know, I would go back to the children and ask them, how would you incorporate this? Rather than as an able-bodied put myself into, how will it benefit you? I would be tempted to get a load of youngsters in, adolescents with hemiplegic CP, and say, you tell me what is the implication. And I think I would probably find that the easier answer than me second guess.
Well, I think that's exactly what we should be doing now. Thank you, Martin.
Thank you, Brendan.